Okay, here we go. All right. Welcome, everybody. My name is Emily Misey. I am a nurse and a student at McKendree University, and I am going to be presenting to you a project on obesity in St. Clair County. It's with a focus on adults. Um, so the reason for this project is just basically to raise awareness. St. Clair County has a exceptionally high incidence of obesity. So if you look here, I have some facts. The Center for Disease Control and Prevention, or CDC, reports that in 2015 to 2016, 93.3 million adults in the United States were obese. In St. Clair County, 35% of adults are obese. And that is compared to top performers in the United States. They are at 26% for adult obesity. So we're quite a bit higher than what we need to be. So you guys might be familiar, I'm sure you're familiar with the health consequences of being obese. There are increased risk for mortality, hypertension, certain types of cancers, dyslipidemia, stroke, heart issues, and also mental illness and bodily pain. So another reason for this project is I'm wanting to implement a plan for our unit and then hopefully make it like a policy thing in the hospital to help nurses, for nurses to be able to decrease obesity in our area. So kind of like how whenever a patient comes into the hospital and we screen for, we ask, do you smoke? And then if they say yes, we provide them with smoking cessation. So basically when the nurse would admit the patient, they would do, based off of what their BMI is and their height and everything. And if they rank as obese, we would immediately on admission start providing them with information on how they can decrease their weight and change their lifestyle factors that aren't so healthy. And then we would continue to reassess throughout the admission. So I know that that can be difficult. The patient isn't always in the hospital for very long, so we can't change everything during their hospital stay, but we can start to help the patient make those changes.
Do you know what kind of resources that we could provide for them?
Yes, I do. I'm actually going to get to that. I have quite a few resources in our area.
Keep going.
All right. So, population health, and that's another part of this project, is that I'm just really trying to raise awareness of population health. So, keeping patients healthy outside of the hospital, so that we can decrease hospital admissions and keep our community healthy, things like that. So I have 3 objectives for this presentation. The first is that the audience will be able to recognize barriers that influence obesity, identify resources that can be provided to obese patients, and identify ways that nurses can help to improve the health of these patients. So at the beginning of this semester that I'm in right now, we were asked to identify 3 key players that would help us with this project. So I wanted to kind of stay within like the St. Elizabeth's network since I was going to be presenting it here and kind of implementing my plan here. I thought that that would be my best option. So my first key player was Janice Poutler, our dietitian. She's been a dietitian for over 40 years and she's great. She has lots of experience with, obese patients and healthy diets and things like that, of course. So we discussed some of the barriers, like what does she feel are the barriers that are, causing people to be, continue to be obese and not being able to change their lifestyle. So she felt that it was mostly a lack of education or knowledge. So, and she actually had mentioned that, she thought it was because doctors weren't addressing it enough. Because when a patient comes into the hospital, they're focusing on what they came in for. So heart failure, exacerbation, when, really there should be more focus on that, because if we could control their obesity, control their diet and their activity, then we might see changes in those things. She also said that a barrier was that we do not have an outpatient dietitian. In St. Clair County, a lot of individuals also feel like there aren't a lot of safe areas to walk. So like poorly lit areas, lack of sidewalks, things like that. And a few other barriers that she discussed were lack of motivation from patients and their family members. Family members can also sometimes be enablers for their loved ones' poor behaviors. Highly priced insurance. She said we need, it would be nice if we could get, more affordable insurance. And then there's also poor follow-up amongst the cardiologists and primary care physicians. So some of her goals were that she wants to decrease the amount of sodium and fats that patients take in while they're in the hospital, provide them education on that, so whenever they're discharged, they will, continue to eat a healthy diet, low in fats and salts. And then she has been working on improving the menu here at the hospital for patients that are on like renal diets, cardiac diets, low sodium, carb control, those kinds of things. And we already talked about she wants to increase the education that patients get. So she is also working to make, I had mentioned she's working to make those diets taste better, because that's a lot of patients complain that's why they're not following their diet, because it doesn't taste good. So she's working on ways that we can make it taste better for them. And she also worked on even the regular diets that have patients on here, a general diet. They are lower in sodium and fats than what they were before. And there's also minimal fried foods on our menu here. So she provided me with some resources. The Jocelyn Diabetes Center, programs and services for older persons, and the YMCA. Those are all in our area. And then we also discussed that, having a diabetes educator, which I think we're in the process of getting, and then we used to have a heart failure educator, so hopefully we'll get one of those again. I know those are really beneficial for patients. So
you mentioned about the, unsafe conditions for walking. Is there something maybe in your plan regarding our cardiac rehab? Because patients with cardiac and pulmonary are able to use that, but it's during certain hours.
Yeah.
Is there a range of when we can use it or who can use it, that kind of stuff with patients as well?
Well, me and Janice did talk about that, because she actually works at the cardiac rehab once a month, and she provides like outpatient education if they, for people that come in. So yeah, it's really important that we can have our patients utilize that, if it's been ordered by their doctor, because it's very helpful. So we just need to encourage them to do that. So yeah, I'm not sure about the hours and everything like that.
Yeah.
Do we do anything directly with the Y at this point, or is
She-
it kind of non-conclusive?
I don't think it's inclusive. She just mentioned that that's a good resource for them, but I don't think that we do anything.
Yeah, I know my mom actually went to a diabetes clinic there,
Mm-hmm.
and it was a pre-diabetes clinic, because I'm
Oh,
pretty
okay.
sure she's a diabetic.
Mhm.
And she had some good information, but the follow-up again was poor. She just stopped going after a couple of sessions, and then I don't think she finished it out. It was supposed to be a 12-week program.
Yeah.
Is that at the Y?
Yeah.
Wow, that's cool. Maybe we can partner with them and see what we got.
Right, exactly. I'm just wondering if that would be an option.
Yeah. Well, and I go to like a small local gym in Belleville, and I've talked with them about like doing something also. So we'll see where that goes, but it's an option.
We can always tell our patients too that, and I mean, not in cold weather, of course, but warm weather, we have a nice
That was
lit up
yeah.
area here.
That's true.
That's kind of what I was thinking, I mean, I don't see why like people that weren't, like why people couldn't just like come drive up here, park in the parking lot, and then
And
just
then
walk
walk around
there.
the lake, yeah.
Yeah, and I feel like that area, it seems like that would be pretty
It's
safe
pretty
there.
lit up, I think.
There's good lighting and everything, so.
Yeah.
So my second interviewer was Amanda Monteleone. She's the physician assistant for Dr. Saha at Prairie Cardiovascular. So we kind of discussed the same things that I did with Janice. The barriers, she kind of had similar things to say as Janice did. She even said, you know, that she felt that it was a lack of education. And she even said, you know, from providers, from physicians. So that was a little surprising to me. I thought maybe she would try to defend that, to defend the physicians, but no, she did agree. And then another thing here in St. Clair County is we often get a lot of like the underserved population. So like from our sister hospitals and like Breeze and Highland and things like that. So often the underserved are in poor health. So, and we also talked about how our high incidence of obesity, it makes our readmission rate increase as well. And then of course that we know that obesity is horrible for your heart health. And she actually explained to me how patients that are obese are more likely to have AFib, which I wasn't aware of before that. So, and then the key player that I learned probably the most from was Donna Myers. She does the community health assessment for St. Clair County and for St. Elizabeth. So we kind of discussed that, and she, again, a lot of the barriers that we talked about between the three key players were the same, you know, poverty, underserved areas, no areas to walk, and she brought up how if, you know, the individual uses public transportation to get to and from the grocery store, what are the chances they're going to have, like, buy all of these groceries, and, you know, they're not going to want to carry them, you know, they're just going to buy, like, quick and easy things like frozen meals and things like that, that doesn't take up much space or much to carry. So she did provide me with some information on different groups that are in the area. So one was Make Health Happen, and they work on improving food access in the area to like the people that live in poverty and you know, don't have a lot of money. And then Healthier Together, which is a policy that was put out by St. Clair County, and it focuses on addressing that we will be 95th percent in the United States in the year of 2025, and that's for like our health rankings. So,
Do you know what percentage we actually are? Because I imagine it's not 95.
I do. I think I have it. I might have it on my board here somewhere. I don't, but I do know. I just don't have it. I don't have the information with me.
That's
but
okay.
I
I
can
was
get
just
back
curious.
to you on that. I have that in a different paper that I'm working on for this class, so I can give you that information. So like I said, one of the main focuses that I wanted to work on for this project was, you know, talking with nurses about how they can help. So, like I mentioned before, the nurses have a big impact on decreasing the obesity in the area. They are kind of the front line with providing the education to the patients. I did read an article by Kathleen Marchiando, and she discussed how, kind of how I mentioned earlier about how we screen for smoking, but we don't really do anything for obesity. So if we started doing this for obesity, we could start to provide that information, and hopefully we would see a decrease in obesity from there. Nurses can also be responsible for like hosting weight loss competitions in their units, like Biggest Loser type things, you know. So many people sign up, and whoever loses the most weight wins a prize or something like that. Things like walking groups, exercise groups. There in Tennessee, there was a project done called Project Diabetes. And it was a weight loss program, kind of how I was just mentioning. And at the beginning of it, so you had to pay a fee. It was like $100 fee, which I could see that being kind of a deterrent for some people. Don't want to spend $100. But it's a 10-week program, and they, at the beginning, they do like a baseline lab values. And then every week they meet to weigh in, and they do educational classes and exercise classes. And then at the beginning of the program, they also met with a pharmacist who would discuss, you know, things about their obesity, consequences, you know, health consequences that the patient may be at risk for. and then the importance of being compliant with their medications. So this program was really helpful for this town because it helped connect the participants with the community. And if they didn't have a primary care physician, they were then connected with one. So that can be very helpful. And they saw a decrease in weight, cholesterol, blood pressure, and then just overall well-being of their community. So we talked about the barriers already. I just wanted to kind of go back to that. Another thing is that there is not a lot of community gardens in the area. So towns that have a high, that have lots of community gardens, they've seen better health and healthier diets. So I think whenever I did a Google search, I only saw that we had like 2 in the area. So that was another thing that me and Jan had talked about, like if there was a way that we could do like a community garden or something like that. So another thing that can sometimes be hindering obesity in our area is that SNAP and WIC benefits. They aim to provide the participants with a healthier lifestyle, but after looking at their website, I found that they cover soda, like sweetened beverages, snacks, cakes, cookies, like all those kinds of things, ice cream, energy drinks. So I just feel like that's kind of contradicting to their goals. There were 2 people that Barnhill and Key that did an article, and I guess in New York a couple years back they attempted to exclude sweetened beverages from the benefits, but that was not successful. Basically, they were saying that if they exclude that from there, it's not fair. It's not ethical, basically, because other people are allowed it, but they were not. So I thought that was
just because of their
Mhm.
economic status. Yeah, that was a big thing in nursing school with our community resource semester. We did a big thing with East St. Louis and how it was a food desert
Mhm.
and stuff in certain areas, meaning that they didn't have access to like nutritional healthy foods. They only had like the little bitty local grocery store that only carried easily, like shelf stable foods,
Yeah.
because nobody could really get to the stores and stuff. And how most of the people had, WIC, or they had food stamps and that kind of stuff.
Mhm.
And like all of the things that were kept in the store were covered, but the store didn't have any type of fresh fruits and vegetables, but that was the only store that they were easily accessible to. So that's the only stuff that they were getting. So that was a huge,
Yeah.
like, we tried talking to like the owner and stuff, like our teacher did, and everything about like,
Oh, wow.
oh, well, you could put in like a fresh fruit like stuff, and it was
Mhm.
crazy. So
That's interesting. Yeah,
Yeah.
that Make Health Happen that I was talking about that Donna had mentioned. When I Googled that, I saw that East St. Louis was one of the areas that they
and that's one of the spots where
serve.
they have a community garden too, because the
Mhm.
school helped build
Oh, wow.
the community
that's
garden in
Yeah.
St. Louis.
We used to have a garden at the old
We
hospital,
did,
didn't we?
yeah.
We
I
did.
wonder
We
why
just-
we haven't started that back up or something.
Well, we
here.
did it, a couple of years, and then we didn't do it for a couple of years, so I don't know the reason behind it, but
Where we
we
ended
should
up
look,
with
we
that.
should look into doing it again.
Yeah.
Yeah. The other thing I found with researching this particular topic is that
Mhm.
it doesn't really work to tell people what to do. You have to figure
Right.
out what they're doing.
Exactly.
So, if we say you need to eat your fruits and vegetables, that doesn't really mean anything to somebody that doesn't have the knowledge behind it. So instead of asking what they actually are eating, so, oh, donuts. And I tell the story of this patient that, we said you have to be low on sugar. You can't eat sugar. And so she said, I'm not eating any sugar. I'm not eating any sugar. But she still had diabetes and she didn't understand why.
Mhm.
And they ordered her a tray, and she gets the tray, and it's completely full of bread and carbs. Like, well,
I
that's
don't
that's
understand
sugar.
a lot.
Yeah, right. The people don't have that understanding. So to
Right.
know that they do eat all of those things and say, whoa, educate them at that point instead of just saying eat your fruits and vegetables, I think is a little bit more productive.
Yeah.
I agree.
Or I know, just for an example, like nurses will be going over discharge instructions with a patient that's, being discharged with an MI or something like that, and they're saying, oh, eat a heart healthy diet. well, they might not know what a heart healthy diet is or what they need to purchase or how to prepare it or anything like that. So I think that's a part of the problem, is that we need to go more into detail about what that is.
Yeah.
Because if you just tell them that, they might think that, you know, I'm trying to think of an example, like eating a frozen meal might be healthier than
Right,
eating
and
McDonald's or something like that, but they're still, those frozen meals are still filled with sodium and other preservatives and things like that.
And you said
So-
regarding the, you know, the physicians educating might help as well, but
Yeah,
I think it's delivery process as well. We can't scold people and say, this is what you need to do, you know, just
Well,
like
and
you
it's, and
said.
it's too late
it's
here
a
when they're
matter
out of their environment.
educating,
Yeah.
Right.
And we need to educate them when they're in their own environments as to how to do this correctly so that they don't come to our environment. Because they're not learning here very
Mhm.
well because there's too many things happening
Right,
all at the same
right.
time,
Yeah.
so.
Right. This
Yeah.
delivery process is a lot of it
Right.
too.
yeah. So we talked about the SNAP and WIC benefits. So I think it's important that if we know that a patient is getting those benefits, we encourage them to choose the healthier options. And I think it's also important that we're telling these people they can have certain, you know, they can have soda and they can have cakes and cookies every once in a while, but they have to do it in moderation. I think it's the overconsumption that's the issue. And then if they have this access to it that's so easy, then that's where the problem is. So just wanted to talk about the goals again of the project. So I want to provide the population with an increased understanding of the dangers of obesity and how to manage their obesity. One of the Healthy People 2020 goals was to promote health and reduce chronic disease risk through the consumption of healthful diets and achieve maintenance of healthy body weight. So I feel like that's I kind of took that goal and then tried to make it into a goal for here, or a plan for here. And then my goal for the nurses again was just to expand their knowledge of obesity, help them feel more comfortable in providing that education to the patients. Because I feel like sometimes, I don't know if maybe like a nurse is worried they're going to offend the patient, or they just don't really know how to go about it. So that might be like a deterrent, and then all that will hopefully help decrease our incidence of obesity in St. Clair County.
When you spoke with Amanda, did she mention anything about like prescription medications that can help for diet supplements and that kind of stuff?
She didn't really mention that, no.
I
I
know a
think
lot of
there's
it
a
is
lot
not-
out there right now
And
that's.
a lot of it's not healthy for our cardiac patients,
Yeah.
yes,
Right.
but just was wondering if,
Yeah.
That would be interesting though.
So it will be a slow process to get this plan into place and to see results from it. Whenever I talked with Donna and we were talking about her committees that she's on and everything, she mentioned, you know, that it's a very slow rolling process and sometimes she faces obstacles on the way. But hopefully, my hope is that by December 31st of 2020, we would see a decrease in the frequency and amount of obesity. So if you go to the county health rankings website, that's how you can see what the percentage of obesity is in the area. Then you can see other things too, like St. Clair County had a really high incidence of STDs and pollution. So I thought those were interesting also. And I think that is just about all. So just to kind of wrap everything up, just really need to push education with these patients. That's one of the biggest barriers, is that there's just a lack of education, lack of knowledge on what a healthy diet is, teaching patients about getting on like their proper exercise regimen, being active, and things like that. So does anyone have any other questions?
you know, you mentioned as well, like the lower poverty people, they are, you know, have poor choosing, but not able to have fruits and vegetables and whatnot. Is there any way or any services that you know of that we could like send like a farmer's market? I mean, they do that in Belleville. Could they do that down in some of them areas as well, so that would give them a choice of to get some fruits and vegetables that would
Yeah,
be
that would
able
be a good
to pay with their WIC, you know, cards or something like that. I wonder.
I don't know for sure, but I know just like going to, I don't know about a specific group, but I know like I went to Schnucks when I was doing all this research, and I did see, I mean, there are like lots of fresh fruits and vegetables that are, they're approved. I just don't know if maybe the awareness of that isn't there, or if it's just that
And
they're
Aldi's
choosing.
Aldi's has some
Aldi's,
good
yeah.
fruit
Right,
too.
but I think it's gotta be a desire thing too, I mean,
Mhm.
just because it's available doesn't mean that's what you were taught to
true.
eat growing
That's true.
up,
Yeah.
so.
You know,
There's a
you
lot
gotta
of-
wanna,
There's a lot of differences that we could make. I wish we had better programs in schools,
I know.
that maybe if we had our school children preparing their own food and, you know, teaching them how to cook and how to, you know, what really they should be eating, I think maybe we'd see better success, but,
Yeah.
you know, it's gonna be a long process, like you
It-
said, but
it
I think
is.
this is a good project. I think this is gonna be great for our patients.
I think it will
I
be
agree.
too, and hopefully everyone will be on board for it. I mean, I think, I did forget to mention one of the facts on here was that in 2008, the estimated medical cost for obesity was $147 billion. So I mean, just think of all the things that money could be
Almost 10
used
years
for.
it's like, wow.
Yeah.
Right.
10 years ago, so I couldn't find like an up-to-date one. I wanted to use something that was before,
Right.
like, you know, in more recent years,
I think they
but
usually only do that every 10 years, and
Yeah.
they only evaluate it, so
I,
they're,
I would think
You
it's
can only imagine what it is
probably,
now.
yeah,
Almost, I bet, doubled,
because the rate of
tripled.
obesity has gone up, so I'm sure that the cost would
Oh, yeah.
have to go up as well.
Just the cost in, that is the medical cost.
Mhm.
Wow.
good job, great presentation.
Thank you very much.
That was
very much.
informative.
Thanks for
Thanks for
coming.
the information.